The CARES Act has expanded benefit coverage in HSAs and FSAs. And joining me to discuss those changes is David Spear, Managing Director at Willis Towers Watson. David, so what are some of the much needed changes?
Well, there's been a lot of changes over the last couple of weeks. The first one from the CARES Act was that over-the-counter drugs and menstrual products can be reimbursed from an FSA or an HSA without a prescription from your doctor. Now, FSAs, the employer still has to offer that change, but from our surveys, many employers have.
And then there's some changes with HSAs and contributions as well?
Yeah, from an HSA contribution, they changed the time frame for making contributions for the prior year, 2019, all the way to July 15th. So they've expanded that, allowing you to make those 2019 contribution changes through July 15th, which gives people a little bit more flexibility in making contributions to the plan.
Right, and that change also includes HSAs funded by employers as well?
Yes, it does. So, for example, on FSAs, the employers are now allowed, if they want, to allow people to revoke election, to add a new election, to change their election. And what that's really dealing with is like the world of dental and vision, where you might be uncomfortable going to the dentist and opening your mouth and being in front of the dentist for quite a while, right? Even all of this year, and yet you've made elections to put money aside. So it might allow you to elect out of those elections.
So I think the bottom line here is lots of changes happening, and people should be paying attention to the news because it seems like because of the CARES Act and because of the COVID-19 pandemic, lots of changes are coming to people's employee benefits.
Yeah, and please, I think that's a great advice. Watch the news from your employers, because they'll be telling you of the changes and describing them, what they're willing to make in their plans.
David, thanks ever so much for sharing your knowledge about the latest goings on.
No, you're welcome.